clap there, please. Hold it up. More. And say action.
Action. I was born in Bristol and I studied botany to start with, and I did quite a number of things before getting into dentistry and then later facial aesthetics. I worked in the Windward Islands as a charter agent on a yacht. I worked as the deckhand on the last steam dredger in the country. I had a printing company, actually in Devon. I sold cars. I worked for the Royal College of Veterinary Surgeons, running a health support programme for errant vets, and one or two other things. So I've had quite a checkered career before getting into facial aesthetics and dentistry. Lovely to see you again, Chloe. You've come back for your review for the cellulite treatment that we did a couple of months ago. How's it been going?
It's fabulous now, really good.
Good.
Yeah.
Excellent. So you've had 2 treatments. It's probably a good idea to think about a third one within the next month or so.
Right.
Then we should be fine for a couple of years.
Okay.
So that's what we'll work towards.
Brilliant.
As you remember, cellulite is where the subdermal fat herniates up through the collagen just under the skin, and it gets sort of tangled up with the collagen and it tethers the skin down so that you get that rather dimply effect. And what we used was the microneedling technique with a local anaesthetic, which you found quite comfortable, I think, didn't you?
Yes.
And that disrupts those tethers and it stimulates growth factors and the cells that produce collagen so that you get a much more substantial collagen layer through which the fat can't come through. So you get a nice firm surface to the skin.
Which makes it smooth again.
Absolutely. And I think that worked well.
Yes, it's excellent, really good.
Great. So we'll sort out perhaps one more treatment in the next month or so, and that should really just take it a bit further.
Brilliant.
Wonderful.
Thank you so
Well,
much.
nice to see you again. We're treating the orbicularis oculi muscle, which is the circular muscle that surrounds the eye and will scrunch the eye up. Now we're trying to partially deactivate the little bit around here, which causes laughter lines or crow's feet. So we're just selecting to treat the lateral part of this muscle. And we can come nearly to the mid-pupillary line, not quite. So we just get some softening there. What we need to do is to watch the landmarks of the cheekbone. What we don't want to do is go south of the cheekbone because the muscles that hold up the lip and so on attach here, and we definitely don't want to affect those. So that's the landmark beyond which we don't want to go. But we're in quite safe territory here, and that will produce a lovely final softening. I've been a dentist for 30 years, hard as it is for me to believe that. And I focus on aesthetic dentistry, improving people's smiles, and that's where the interest in facial aesthetics came. You produce the nice smile, let's frame the smile. I love this. Excellent.